Harold Shipman, known as Dr.death, was a British medical doctor who was responsible for over 250 deaths, making him one of the most prolific serial killers in modern history. Born on January 14, 1946, in Nottingham, England, Shipman was the second of 4 children to working-class parents. As a child, he was described as quiet and withdrawn but intellectually gifted, excelling in his academic studies. Shipman's fascination with medicine began during his teenage years when he worked as a hospital porter. He went on to study medicine at the University of Leeds and qualified as a doctor in 1970. Initially, he worked as a trainee surgeon before settling on a career as a general practitioner in Hyde, Greater Manchester. For over 25 years, Shipman was a trusted and respected doctor in his local community. He was known for his house visits, particularly to elderly patients who lived alone. He built up a loyal patient base, and his charm, professionalism, and caring manner made him a popular figure. However, in reality, Shipman often falsified his patients' medical records, changing the cause of death to cover his tracks. Shipman began to attract attention in the late 1990s when a local solicitor, Angela Woodruff, became suspicious about the death of a client, Kathleen Grundy. Grundy was an elderly lady who had made a will in favor of Shipman. After her death, Shipman had quickly completed the Medical Certificate of Cause of Death, MCCD, attributing it to natural causes. However, the solicitor thought it strange that Grundy, who was in good health, had died so suddenly. She contacted the police, who began to investigate. An autopsy revealed the presence of diamorphine in Grundy's system. Further investigations found that Shipman had been the last person to see her alive and that he had changed her will after her death. He was subsequently arrested, and the authorities began to investigate other deaths that had occurred under his care. The investigation revealed that Shipman had systematically murdered at least 250 of his patients, although the actual number of victims could be much higher. He had done so by administering lethal doses of diamorphine, often under the guise of pain relief. His primary victims were women aged 65 and over, who he targeted during house visits. His killings had gone undetected for so long because he was seen as a trusted and respected doctor in the community. In January 2000, Harold Shipman was found guilty of 15 counts of murder, 1 count of forgery, and 1 count of theft. He was sentenced to life imprisonment without the possibility of parole. In prison, he refused to admit his guilt, repeatedly claiming that he was innocent. The case of Harold Shipman sent shockwaves throughout the UK, and it resulted in significant changes to the way medicines were prescribed and administered by doctors. The General Medical Council reviewed its procedures for dealing with complaints alleging serious professional misconduct. And the NHS implemented systems that would alert them to any irregularities in prescription practices. In conclusion, Harold Shipman's case is a tragic reminder that not all doctors can be trusted. His manipulative behavior and ruthless killing spree have left a legacy of mistrust and fear in the medical profession. His case is a warning that those with power and authority must always be held accountable for their actions, especially when they hold the lives of others in their hands.